seismic shift is underway in U.S. vaccination policy, and it's sparking fierce debate. This week, a newly appointed CDC advisory panel, chosen by Health Secretary Robert F. Kennedy Jr., is set to vote on sweeping changes to childhood immunization guidelines. These decisions, if passed, could reshape how millions of American children are protected against diseases like hepatitis D, measles, and even the ongoing threat of COVID-19. But here's where it gets controversial. Critics argue the panel's makeup and proposed changes lack scientific rigor, while supporters claim they're correcting past overreach. Let's break it down. The Advisory Committee on Immunization Practices, ACIP, now under Kennedy's leadership, is poised to act on two major issues this week. First, it will consider removing the recommendation for the combined MMRV, measles, mumps, rubella, and varicella, vaccine for children under 4. Second, it plans to vote on delaying the hepatitis B vaccine for newborns, unless the mother tests positive for the virus. These proposals hinge on studies suggesting the MMRV vaccine might slightly increase seizure risk in young children, and that hepatitis B vaccination at birth has been less effective than targeted strategies. But here's the catch. The CDC already allows parents to choose separate vaccines over the combined version. And delaying hepatitis B shots could leave infants vulnerable during critical early weeks. Kennedy's overhaul of the ACIP has drawn sharp scrutiny. After replacing the previous 17-member panel with 12 hand-picked experts, many with known anti-vaccine leanings, he also scaled back recommendations for the COVID-19 vaccine. The committee's chair, Martin Kulldorff, a biostatistician and epidemiologist, has defended the panel's credentials, dismissing accusations of bias. Kulldorff, who was fired by Harvard for refusing the pandemic vaccine, argues the group is pro-vaccine and cites their recent decision to remove flu shots containing thimerosal, a mercury-based preservative. While thimerasol's safety is well established, critics counter that this move plays into public fears without scientific justification. The controversy deepens with the recent firing of CDC Director Susan Monterez. She claimed Kennedy pressured her to rubber stamp his agenda, leading to a mass exodus of senior officials. Kulldorff, meanwhile, has challenged former CDC leaders to a public debate, calling their criticisms unfounded. But is this a clash of ideologies or a legitimate concern about science-based policymaking? The stakes are enormous. Hepatitis B vaccination at birth, for instance, has been credited with an 80% drop in infant deaths since 1991. As one former panel member, Noel Brewer, noted, risk-based vaccination rarely works because people don't see themselves as high risk. So where do you stand? Are these changes a necessary correction to overzealous vaccine policies, or a dangerous rollback of public health progress? The ACIP's votes this week will shape the future of pediatric care in the U.S. But the real question is whether science or ideology will guide the outcome. Share your thoughts. Should vaccine policies be driven by data or by political agendas?